for sound. Hi, everybody. I am Janice MacInnis from Halifax, Dalhousie University. I'm the manager of organizational health there, and my role was created in 2009. And so I'm focused on employee workplace well-being. So I have colleagues that work on the student health promotion side, so I'm focused on workplace wellness. And so I've worked at Dal for a very long time, 25 years now. And so I just want to tell you a bit about our journey. Oops, sorry. Jeez. Oh.
I spoke too soon.
You did. Why am I not? Zoom slideshow. How come I can't slideshow?
Okay. To go next.
Never seen that. So if I just click the next one, I click the next slide?
Yeah.
Nope.
No.
Okay. How odd is that?
Let me see.
I can just talk.
There we go. No? Yes? It's happening slowly.
All righty.
Aha.
Thank you.
Okay.
That worked?
We like it more now.
Excellent problem solving. All right. So, as I said, I've been in this role, organizational health, since 2009. So we created the role and the strategy in that year. And I was given way more autonomy than I was given resources. So I worked with what I had, which was the autonomy. So I leveraged the networks that I already had in place from working at Dal for so long, and my intimate knowledge of the place, and just started making things happen, essentially. So I'm a resourceful person by nature, and seem to be fairly resilient, the evidence would indicate. So if you look at the graphic, I'm one of these little tiny wheels that through, in fairly informal interactions with people, you start moving a little wheel, and then wonderful things start happening. That's been my experience in the 6 years that I've been working with this specifically. And I also like the notion of the ripple effect, right? You have one conversation with one person, and you really can't quite tell where that's going to end up, and nor can you really tie it back later on to that original conversation. So I'm assuming you want to know just some of the things that we've done. So I've got a list of some things that I'll just give you a very high overview about, and I'm happy to consult further after this session. So right off the bat, I created a Healthy Workplace Collaborative, and the name is on purpose because that sets the tone for how the group will function. So these are people across Dalhousie who have some component of health in their role. So we were very siloed up to that point, so I wanted to start cutting across the silos, getting people talking, and so that group has now shifted from sharing information about what each individual area was doing. It became the selection committee for my next point, which is our Healthy Workplace Award, and now the next phase for this group is actually developing proposals that will hopefully affect policy at the institution. So that group has really morphed, again, from a very simple invitation to be involved. We created a Healthy Workplace Award several years ago, and this was an effort to find the bright spots that are already existing within organizations. So working with what we had. Who's doing really good stuff? Let's acknowledge them and celebrate those successes. So bought a trophy, got that money sponsored by one of our benefits providers, and we used the same trophy. You can see it here. It's a lovely glass apple, stylized glass apple on top of a perch. We use the same trophy every year, so each department gets their name added to the trophy as each year goes by, and then they get to display the trophy in their area for that year, and then they have to give it back. And this now has morphed from, not really sure what that is, to the fairly sophisticated submissions now for the awards. Leaders want to win this award, so they are now starting to put things in place to build up their submission for future years. So we're looking at shifting practice that way, through that desire for recognition. We have a Pink Day to promote respect on campus. So this is one of those things that cuts across and is a full community effort. So faculty, staff, and students are involved in Pink Day. We're about to have our 6th annual Pink Day. And rather than, it focused on bullying out of the gate, but we very quickly said we don't want to talk about bullying, we want to talk about what we want more of, so it became our day to promote respect on campus. There's no owner of Pink Day, there's no budget for Pink Day, but we have a group of people that come together across various stakeholder groups. They all contribute what they can. Time, energy, little bits of money here and there. And we get sponsorships and so on. So that has become one of our signature events at Dalhousie. Our difficult conversation videos. Oh, let me address the picture. So these are some of our facilities management gentlemen participating in Pink Day. And the facilities management department has taken on Pink Day in a big way. And so they do their own activities and initiatives as well as the institution-wide ones. And they bought 400 pink t-shirts. And they give those out every year to all of their staff to wear across campus, and then they collect them back and then give them out again the next year. So these are the people that you see literally from one end of campus to the other. So on that day, all of these people who work in every part of our campuses, they're donning their pink garb as well to promote respect at Dal. Our difficult conversations videos came out of our conflict resolution training that we developed, and we had the workshops in place. They were quite successful, but we knew that people wanted some just-in-time kind of resources. So we wanted an online series of videos that people could access when they needed to have a difficult conversation that would help prompt them and coach them to be ready for that conversation. So what we did was we tapped some key people on the shoulder to volunteer to be videotaped having difficult conversations with each other. So these were unscripted in a variety of scenarios, showing a variety of roles. And so we brought them into a room, set up a camera, gave them a scenario, and shot whatever happened next. And many of them are first takes. So they're not slick. And people like the fact that they're not slick. They're more spontaneous. People are reacting in the moment. It's more of a difficult conversation that you would probably have. And so we have 11 of these videos now. They're on YouTube. So if you go to YouTube and search for Dalhousie's Difficult Conversations Project, use them, please. Feel free to use them. We've had great connections. They're used in Atlanta, they're used in San Diego, they're across North America. So we'd love to see them used worldwide. That's part of what our philosophy is to share broadly. So Dalhousie's Difficult Conversations Project on YouTube. But let us know how you use them, because we love to know who's using them for what. So a few more of the things that we've done. So many organizations, large employers have an employee assistance program, and I guess part of my advice around this one is to make sure that you're squeezing as much out of those programs as you can. So in addition to the counseling, work-life solutions kinds of coaching that they do, we've also used their wellness education programs, we've used their workplace referral program, and unfortunately we've used their trauma response service as well. We've had occasion to use that. So make sure that if you've got a program in place, that you're squeezing as much out of it as you possibly can. If you're already paying for it, you might as well be optimizing it. I've also made a lot of connections across institutions. So other universities in Canada, part of a community of practice. Tracy Hawthorne is here. She's been leading us in that group. So if there's a question, I want to know what other organizations are doing, there's that easy network to access when I need it. Other organizations within the Halifax area, so with our hospitals, for example, with other universities locally, I've made connections there. I'm part of a healthy workplace network in Halifax, Nova Scotia. So large employers like Dalhousie, reps doing similar work that I do, come together and we talk and we share resources and ideas that way. So again, it doesn't cost anything, but a tremendous way to access expertise from other areas. You don't have to reinvent the wheel with this stuff. Our workplace survey, so every 2 years we survey all of our employees and ask them questions about what it's like to work at Dalhousie. And this year, 2015, we actually switched up the conversation a little bit. We changed the survey tool to use Morneau and Associates Total Health Index. So that actually now assesses employee health at the same time as assessing their views of the workplace. So my advice there is to look at your existing practices and see where can you inject some health component to something that you're already doing, right? So rather than trying to push and push and push, can you just inject some health component to something that's already going on?
So when you say your employees, would that include the faculty or?
Faculty and staff, yes. Yeah, so we're surveying them every 2 years. Our telework policy. So we developed a telework policy which is giving people the flexibility to work remotely, so not necessarily coming to work every day. So this again aligns with the sustainability conversation that we've heard about already, but also the flexibility on how work takes place and where work takes place. So, you know, again, a fairly slow process of having conversations, about asking people in key positions to review other telework policies and kind of get their sense of how it is. And along that way, you kind of nurture it along and you consult and you get approvals at various levels. And before you know it, well, not before you know it, after a long period of time, you've got a policy in place because the conversation starts to take on life of its own. And then we're looking at shifting perceptions, right, about how work takes place. So again, that policy piece can give you a lot of leverage because now Dalhousie University has made a statement about working remotely. So you can then leverage that in various ways, often with your management staff. We initiated a caregiving support group. So again, it doesn't cost any money. It came out of a series of lunch and learns that we had that were offered by our employee assistance program on caregiving and being a caregiver. And the poor presenter, she was trying to give her information and all the participants wanted to do was talk to each other about what their experience was and to be able to share that. So that twigged for me, maybe we don't need the presenter. Let's just get people together, created a support group, people come and we facilitate a conversation with whoever shows up. And people are so incredibly appreciative of that very simple thing, just creating space for people. And the ripple effects of that, I believe, are tremendous. Their sense of Dalhousie caring about them, that sense of loyalty to the organization, because they're showing that, you know, out of the box of people's jobs, that the institution gets that adult caregiving in particular is a real challenge for people. So we've made caregiving now a workplace issue, which is important to get on that agenda. And the last one on this list, and I could go on, are academic partnerships. And so you've mentioned student placements in the last presentation. So it's about how do you leverage student placements, student research, faculty research on the areas that you believe can make some difference. So I just want to illustrate one of these for you. So I was deemed a matchmaker through this arrangement. So I met with the manager of custodial services. So these are individuals who are ensuring our workplaces are clean and safe and our learning environments as well. But we have an aging workforce, we've got a physically demanding job. So you put those two things together, and what you often end up with are chronic pain and injuries. And when you have chronic pain and injuries, you often end up with absences, and then therefore return to work processes have to kick in. So what we did, and all I really did was have one conversation and send one email, so I'm not going to take any more credit than that, but I contacted the director of our School of Occupational Therapy and said, is there any way that you can help with your programming to offset the experience that we're having with our custodians? So what they managed to put in place were a series of student placements, and they job shadowed custodians. They had cameras. They took pictures of people doing various work. They did lots of surveys. So we ended up with a series of job demands analyses. They launched a safety campaign and an injury prevention campaign. So a tremendous, they managed to pack an awful lot into a short space. And so now they want to expand that time-wise, but they want to also expand it into other areas within the organization. So the goal is to change that equal sign there between the demands of the job, and maybe an aging workforce and a physically demanding job doesn't have to mean chronic pain and injuries. So we're looking at ways that to change practices there. So a success story, I believe, and the faculty members involved are now looking to do research on that endeavor that took place as well. So they'll be doing evaluation and broadening out on that. So a lot of things do take money, though. And so you have to be a bit more creative often. I do have a little budget, don't get me wrong, I have a little budget, but that's often not enough to do everything I want to do. So let's backtrack though. Money doesn't grow on trees, but it might actually hide under some rocks. So you have to be a little creative. So my job is actually funded from a rebate that Dalhousie gets from our employment insurance premiums. Okay, so there's low usage of EI from our employees, so we get money back, and that actually funds my job, and as well as a few others. So that's how all of this kind of started. We also have health spending accounts for our employees, which means that they can access various health supports and get money back for that. Not everybody's using all of their money, so there's a surplus. So I've now been given additional funding because that money should be tied to wellness. So I've been given additional funding to do some project work from that. I mentioned sponsorships, asking questions of various stakeholders of would they like to support this, that, or the other initiative. We were awarded a grant from the Heart and Stroke Foundation to be a walkable community. So they have a series of walkable community grants. So we were given a little bit of money there. And last resort, which we very, very rarely do, is to charge participants to participate in these programs. If that was the only way to get something up and running that we felt strongly about, then we would look to charge some kind of a user fee. So, in closing, I think the key for me in my role is to think about abundance rather than scarcity. I mean, you could always wish there were more, but if you look around, there is a tremendous amount that's available to you. And especially at a university or a college, I believe, you got to mine for the gold. They're a hotbed of expertise and energy and passion and people who are committed. And I think you just need to find out where those spots are. Go where there's energy. So I've given up on all kinds of ideas because there just didn't seem to be a lot of energy around it. So I abandon one and I start up another one and see where that takes me. And then, that's the resilient piece. If you're too hard-headed about it, I think you're setting yourself up for disaster. So, you can bang your head against walls for a very long time, but that's not my style. So I give up, find another wall, and see what happens there. A lot of what I do is trying to build community. So in small little groups or in larger institution-wide avenues, I think it's important that we be looking at our teams, our workplaces, our institutions as various forms of community. And I think you need to be well yourselves. You do need to be resilient. There's a lot of conflicting priorities, so often you need to change things up, and that does take your own you have to question your own ability to self-care and get yourself geared up for the challenges that will be in place, because they are a part of the equation. So, what small efforts will you make that will have large outcomes? And I'm happy to take your questions now. Are there any at the back? Go ahead.
How did you get people to your collaborative group? So you had a new job established without sort of necessarily a framework in place for how to execute. How did you get people to the table?
I was very fortunate because I've worked at Dal for so long. I had a lot of goodwill built up, and so I really that's really all I had going for me at the beginning. So the fact that I was asking really increased the chances that people would participate. So it really was just an invitation to come and share, and people were eager to do that because they had operated in silos for so long and had the frustrations that went along with that. I think they were eager to try and offset some of that.
Sorry, just to clarify, I think you already said this, you're situated then within HR and structure?
I am,
Yeah.
yes. I work in human resources at Dal. Yes, Tracy?
Mine was just a
I'm going to just stop because I'm a head nurse.
Oh,
I asked if you guys could have a discussion afterwards because we are sticking to a schedule.
oh
It's
my.
not a question, it's just a plug. Just go on the website, check out the Healthy
Okay.
Workplace Award because it's phenomenal the work that she has done.
Thank you, Tracy.
I've never seen anything like it in Canada, so please go to the website and check it out.
All right. And reach out to me at healthydal@dal.ca if you'd like to have a conversation further. I'm happy to consult. Thank you.
You'll be staying around after.
Absolutely.
Any questions, comments, any thoughts? That'd be great.
Yes.